Good morning mga kapamilya! Live na live po tayo sa ating Salamat Doc online platform sa atin pong ABS-CBN YouTube channel at hinihintay natin ang Jinkas na siya live online live episode. Ayan, online. Wala pa sa...
Sige ma'am.
Sige. Naka-on na ba yung cell data niya? On na naman. Okay, sige. So, for now, let's start with our discussion. We just finished with our Salamat Doc Channel 2 live episode. And, of course, we continue to do this to be able to help more kapamilyas. Everyone's on Facebook, everyone's online. And by sharing this information, we're able to help those who need medical advice, diba? Those who need medical assistance. So for today, ayan, welcome na rin po sa aking followers sa aking Facebook page, Jing Casaneda Facebook page. So Mommy Jing pa rin po. Also, welcome to the Salamat Doc followers and our ABS-CBN YouTube channel followers. Our topic for today, after finishing the Channel 2 live telecast for Salamat Doc, we're now doing this online, and our topic for today, again, is still cancer, Cancer. And our guest doctors are Dr. Michael Alan Hernandez, our Filipino oncology surgeon, and Dr. Mu Feng, our oncologist and Vice President of the Fuda Cancer Hospital. So, Doc Michael, yung atin pong paksa ngayon ay cancer ng ang dami klaseng mga cancer, Doc, no?
Pag-usapan natin ngayon ay isa sa pinaka-common na cancer sa lalaki, yung prostate cancer.
Okay.
At pagbibigyan natin mahabang
yung tatlo na lang po.
Let's give more emphasis dito or give more time sa prostate cancer kasi siya yung number 3 sa leading cause of cancer sa lalaki and number 4 sa all sexes. Okay, both sexes. And then pag-usapan din natin yung cancer sa kidney, yung renal cell carcinoma at saka yung urinary bladder cancer. Pero ito hindi mas common. Nasa 18 or 19 lang sila, number 18, 19 of the leading cause of cancer sa Pilipinas. Okay, magsimula tayo sa prostate cancer. Una-una, ito ay cancer lang sa lalaki. Kasi lalaki lang po ang may prostate. Nasaan ba itong prostate? Itong prostate ay nasa ilalim po ng ating bladder o pantog na dinadaanan po ng ihi. Ano bang trabaho to? Ang size nito sabi sa libro kasi para ba ito isang size lang, isang walnut. Siguro malaki-laki ng konti sa lansones. Isang walnut size. At ang trabaho nito ay magbigay ng seminal fluid na nagbibigay ng sustansya, nutrition sa mga sperm ng lalaki. Okay. At since na ito ay isang gland din, pwede rin siyang magkaroon ng cancer. Ang dahilan ay hindi pa alam ngayon kung ano talaga ang dahilan bakit nagkakaroon ng prostatic cancer ang lalaki. Pero kagaya ng ibang mga cancer, ang prostatic cancer din ay nakikita sa mga taong hindi healthy living, abusado sa katawan, matinding paninigarilyo, matinding pag-inom ng alak, kulang sa exercise, at may mga lahi na may prostatic cancer sa pamilya. So pag ang mga ito, tinatawag nating high-risk group, ay pinapa-examine agad sa batang edad.
Okay.
At ang pag-examine dito ay dalawa ang pinaka-common. Isa either pakuha tayo ng dugo, ang tawag ay PSA, Prostatic Specific Antigen, or yung digital rectal exam. Okay? So kailan, anong edad ng lalaki, kailangan sumailalim sa kanyang procedure, sa ganito exam. Pag ikaw ay high risk, even as early as 40 years old. Pero kung hindi naman, 50 years old.
Okay. So, itong itong prostate cancer, Doc Mike, ay isang uri ng cancer na madaling maagapan, Dapat. So, kung susundin yung inyong sinasabi na pagtapak ng 40 every year, dapat nagpapacheck. Oras na malaman mo na ikaw ay may stage 1, 'di ba? Na prostate cancer, dapat to agad, maagapan agad, hindi nakakalat. Okay. So, ang next question, Doc, itong procedure, the procedures which we can get from Fuda Cancer Hospital, these procedures are also applicable to prostate cancer. Okay. at what are these procedures, what is the treatment protocol, and at what stage of prostate cancer can this be administered?
Yes. In food cancer hospital, we are good at cryoablation because cryoablation is a new protocol approved by US FDA for kidney cancer, for prostate cancer. And because many patients suffer from prostate cancer are old people, so they also suffer from some other chronic disease. Their heart, their lung, maybe their liver, their blood vessels has some disease, so they cannot easy to tolerate the open surgery. And if they undergo the open surgery, then the side effect will happen, the complication will happen. That's why we recommend cryoablation for those old people suffer from prostate cancer. And the prostate cancer is age-related cancer. If the man is older, then the incidence of prostate cancer is higher. So that's why we recommend this. And according to the data analysis reported by USA, cryoablation for the localized advanced stage prostate cancer can benefit more from cryoablation than surgery, then brachytherapy, then radiation, and then chemotherapy, and even then hormonal treatment. So we need to combine different modalities.
Yes.
Yeah, but cryosurgery should be main part inside. That's my idea for prostate cancer. And for kidney cancer, if the tumor is not very big, because according to American Journal of Surgery, according to their report, for the small tumors, for the small kidney cancers smaller than 4 centimeter, ablation has the same 5-year survival rate with the open surgery. And considering the open surgery has maybe more suffering, more complication, I think better to receive cryosurgery. Or if their kidney function is not so good, or if I also met some patient who underwent a nephrectomy, means one kidney has been removed. In another kidney, when they suffer from cancer again, they cannot receive treatment in this situation. But using cryoablation, we can control those cancer.
Okay. So, Dr. Mu, what is the difference between cryosurgery used for prostate cancer and using the usual? What are the usual treatments? I'll refer to you first, no, for the usual treatments.
Especially pag lahat ang cancer kasi kalimitan dapat ang paglalo solid tumor. Surgery.
Surgery talaga.
Okay. Tanggalin. Okay. Ang isang standard treatment for early case of prostate is an open prostatectomy. Okay.
Which means
bubuksan, hihiwain, sometimes binubuksan namin ang urinary bladder and then remove the prostate from there, or the retropubic prostatectomy. So maraming mga, but still bukas, open. Okay. Remove the organ. Sabi nga ni Dr. Mo, lahat yan ay mayroong pwedeng maging komplikasyon. Okay, maraming pwedeng magkomplikasyon. Una is pwedeng magkaroon ng stricture sa daanan ng ihi. Okay, at mahirapan sa pag-ihi. Pwedeng magkaroon ng infection, and then pwedeng mayroong mga injuries ng mga nerves. Kaya iba nagkakaroon ng impotence. Hindi na nawawala yung erectile dysfunction, nagkakaroon sila ng erectile dysfunction. But so that's open surgery. Okay. Pero kalimitan nga, since na ang pasyente natin ay matatanda, kasi kalimitan po na may prostate, kasi prostate cancer goes with age. So kalimitan ng matatanda, una, marami na may sakit ng hypertension, diabetes, COPD, heart problem, liver problem. Hindi na magandang candidate for an open surgery. So ngayon, isang options is to do the minimally invasive, which is the cryoablation naman. Ito naman, with the CT scan guided or ultrasound guided, dalawang probe o dalawang needle, ipapasok lang doon sa may prostate cancer, and then i-freeze siya. Using the argon gas. I-freeze siya hanggang negative 150 degrees.
Wow. And
Okay.
then?
So, i-freeze siya. Pag na-freeze siya, mamamatay siya. Okay. At kakainin lang siya ng katawan ng tao. Okay, mag-freeze siya. Okay. At the result is the same. The outcome, the survival rate is the same.
5 years,
With
no?
hindi ganong kadaming komplikasyon. Okay, you achieve the same result with hindi ganong karaming complication. At the same time, ligtas yung pasyente kasi walang hiwa.
Yes, correct. Okay. So, Doc Mo, how about if the cancer cells have already metastasized? It has spread out to different parts of the body.
If the patient is in stage 4, means patient has many other metastases. In this situation, this kind of patient are not candidate of surgery. But still, we can recommend cryoablation to control the primary cancer. At the same time, of course, we need to combine other treatment like hormonal treatment. This is the routine way to control most of the prostate cancer. And also, if the patient has bone metastasis, patient need to receive some medicine like a Zometa, zoledronic acid, Exiva to protect their bone. And also, this can maintain the patient for a very long lifespan. Yeah, that's the way we do. And for some patient, we can also do iodine seed brachytherapy for the prostate cancer. It depends. If the tumor in the prostate is bigger, we do cryosurgery. But if the tumor is not so big, it's only 1 centimeter or 1.5 centimeter, we can also use the iodine seed implantation, because that is one kind of brachytherapy. We need to combine for stage 4. Need to combine different protocols.
Okay. And then also, Doc Mike, yung chemotherapy, yan kasi ang usual, no, sa Pilipinas. Okay. Paki-explain lang kung may papel ba ito dito sa ating cryosurgery o wala. And then maybe you can also expound on brachytherapy. What's brachytherapy?
Hindi ganun ka-responsive ang prostate with chemotherapy. So, hindi masyado nare-recommend ang chemotherapy for an early stage, okay, of prostatic cancer. So, talaga ang dyan is surgery, okay, local control, with either open or cryo. Okay, pag nag-extend, do some brachytherapy.
What's brachytherapy?
Okay, brachytherapy is a form of radiation. Okay. Mayroong mga iodine seeds. It's like parang grain lang. Okay, rice grain. Ganun lang kaliliit. Pero they are embedded with iodine 125. Ini-implant, itinatanim yon sa mga may cancer. At nag-i-emit siya slowly ng radiation. Confined lang kung saan tinanim. So, hindi siya kumakalat sa ibang parte na hindi kailangan na. Kasi precise yung pagtatanim nila. 1 centimeter lang yung abot ng radius ng kanilang emission ng radiation. And ito, nag-emit siya slowly, hindi yung biglaan. Okay? And that iodine seeds will be there for life. So pwede rin yun na meron din tayo dito. Okay? There's also one form of local control for the cancer. Yung isa pa rin na ginagamit is the hormonal treatment. Since na ang prostate ay may hormonal relasyon sa lalaki, sa testosterone. Okay? So, binibigyan ng anti-testosterone or hormonal treatment. Kasama rin siya sa protocol for the treatment of prostatic cancer. So, surgery, then, yun nga, brachytherapy, hormonal treatment. Ang chemotherapy is really reserved for very extensive stage 4 prostatic cancer.
But it still can be used?
Yeah.
Okay. So, after the surgery, what will happen? How many days before the patient will be able to go to his normal work?
Yeah, after cryosurgery, around 2 weeks, then the patient can be discharged, and then they can live their normal life. They can pee normally. Yeah, and then the tumor can be controlled.
Do they need to go back to you for checkups all the way in China?
No. I think it depends. Patient can also receive the examination, the follow-up here. it can go to the local doctor to undergo maybe MRI or PET-CT or PSA test to evaluate whether this treatment is effective or not. Is there any residue? If there is no residue, they don't need to go back. If they have some residue, they can consult doctor again. Maybe need to another treatment to control the residue.
Okay. Doc Mike, how about for the other kinds of kidney, the other kinds of cancers, like for the kidney and the urinary bladder?
For the kidney cancer or the renal cell carcinoma, okay, so usually nakikita rin yan, yung pag maaga pa, okay, ang ginagawa natin dito, tinatanggal ang kidney, total nephrectomy sa side. Pero ngayon, since minsan may mga pasyente, lalo na may edad din, compromise na yung kidney function. Na pag tinanggal mo ang buong kidney, isang nagpa-function, baka lalo pa ma-compromise. So may tinatawag na partial nephrectomy. Okay? Tinatanggal ang kalahati, pinipreserve yung kalahati. Cryosurgery has also a role, okay, in renal cell carcinoma. Ina-ablate, cryoablation din. So napipreserve din yung natitirang function ng kidney. And still, the outcome is the same. The same. For the urinary bladder is different. Okay? Urinary bladder we can do cystoscopy and do some TURBT, okay, resection, and then do some chemotherapy. Ito yung chemotherapy na intravesical para ipapasok na through a catheter yung chemo papasok sa bladder.
Targeted.
Parang hihugasan. Parang pinapakon lang. Yeah. The liquid, the solution will stay in the urinary for some time to kill the cancer cells. Yung transitional cell carcinoma, pwede rin yun. Pero pag kumalat na, or matindi na, yung cancer mo beyond the muscle, tanggal ang bladder. So, and the patient will live with ostomy, ureterostomy. Or, we will create a bladder, a substitute bladder with the intestine. But the complications na madami.
Talaga?
Very matindi the complication. We will use the large intestine as the bladder. Tapos meron pa rin siyang stoma. Okay?
It's difficult, no?
Mas difficult.
Okay. Well, final question about that, no, Doc Mike. How do you get urinary bladder cancer?
Still, ang hirap sabihin sa kagaya din sa prostate, what's the real cause of the urinary bladder and the kidney cancer. Okay. Pero still, lahat nga, everything naman for cancer, it's the way we live. Okay, the healthy lifestyle, the food we eat, everything that comes into our body, there's an effect to us. Okay, and if we're doing it for quite some times, we abuse ourselves. Okay, and these toxic materials that come in our body, that stays in our body, okay, so it can have an effect whether any part of our body. Okay, so ganoon. For the prostate talaga, whether you are sexually promiscuous or you are hindi, yon, but not walang conclusion, walang direct effect whether you are sexually active or not. Hindi masasabi with prostatic cancer.
Okay. So Dr. Mu, maybe you can give us your last few words, your message to our followers as to where can they contact you and other information.
Yes. First, I would tell to the cancer patient, if you suffer from cancer, don't be so easy to give up, because the medicine develops very fast, and doctor has more protocols to treat and control cancer. Now cancer become a chronic disease. That means the patient can survive very long, but our hospital has one satellite in Makati, Centuria Medical Makati. This is the only office in Philippines. So if you need free consultation, you can contact our staff, Mr. Cruz, to make appointment. Maybe I can give you another second opinion to control cancer. It's my pleasure to be here to introduce the knowledge about cancer. We hope you recover soon.
Mike?
Kaya po sinabi ni Dr. Mu, ang cancer po ngayon hindi na po death sentence. Okay. Marami na po tayo ngayong mga ginagawa, pamamaraan to control cancer. Ang ibang cancer po talaga ay hindi maiwasan kasi sometimes sinabi natin mana-mana. It's our genes. Pero sinasabi po namin, kung hindi po natin maiwasan si cancer through healthy lifestyle, avoiding cigarettes, as I said, alcohol drinker, lack of exercise and everything, if we cannot prevent it, please naman, sana we catch it them early. Para ho mas maganda ho ang gamutan pag ho early stage. So paano po yun? So wag po nating baliwalayin yung nararamdaman natin. At pag sinabi po na nagpakonsulta po kayo at sinabing gawin itong test na ito, kunyari po guys sa prostate, kasi kanimitan po ng prostate cancer, sa early stage, wala po nararamdaman ang lalaki. Normal po yan, normal ang pag-ihi, wala nararamdaman. Pero po, once you reach the age of 50, nandiyan na po, lumalabas na po yung prostate cancer. At malalaman lang po natin yan through a blood examination, the PSA. And kung minsan hindi pa ho nakakapa with yung digital records, pero mataas ng PSA. So nagkakaroon po ng hinala, oops, baka may prostate cancer ito. Let's do the biopsy. And hindi po naman ibig sabihin na po kayo minaramdaman na sa pag-ihi ay kayo mayroon ng cancer. Marami rin pong dahilan kung bakit po may dalawa pong sakit din na nagmimimik ng cancer. Yung tinatawag namin benign prostatic hyperplasia, BPH, saka yung prostatitis. Pareho ang simptomas nila. Pero kaya po, huwag niyo pong sabihin na ako'y naramdaman dito, baka may prostatic cancer ako, bali wala na, bahala ng Diyos sa akin. Hindi po ganun. Safe pa ho na magpa-check up po tayo sa doktor pag minaramdaman po kayo para masabi, may cancer ka ba o wala. Kaya rin po sinabi ni Dr. Mo, napakabilis po ngayon ng advancement. Ang bilis po
correct.
ng invention regarding the treatment of cancer. Kaya po, who knows, baka po sa susunod na mga buwan, susunod na taon, talaga po malabanan natin, makontrol na natin, makonquer, makakuha natin po ang cancer. Kaya po, wag pong matakot. Pag sinabing may cancer, wag pong matakot. Magpatingin. Okay? Magpatingin po tayo.
Ayun. Naku, ganda ho ng mensahe ng ating mga doctor, si Dr. Michael Alan Hernandez at syempre si Dr. Mufeng from the Fuda Cancer Hospital. Again, paalala po nila na huwag baliwalain and magpa-check. You can contact them at the following numbers.
Centuria Centuria Medical Center po sa Makati. Okay, yun po ang Fuda Satellite Office here. Okay, you have to contact Mr. Segundo Cruz. Hindi ko lang alam yung pa-flash na lang po natin yung number po nila sa Centuria Medical Makati. Okay, yun lang po nag-iisang satellite center ng FUDA sa Pilipinas. Okay? Si Dr. Mo po ay nandito every 2 weeks. Nagbibigay po siya ng libreng consultation. Sa ngayon pong linggo, from mula Monday hanggang Friday, nandito po siya to give you free consultation. And Jing, sana i-plug ko na rin po sana ngayon. Pamaya pong hapon, meron po kami free seminar. Dr. Mu and I, ay nandun po kami sa Club Filipino, Kalayaan Hall, para magbigay po ng libreng seminar regarding cancer. So kung makakapunta po kayo, tawagin lang po nyo si Mr. Segundo Cruz for a registration at sasagutin po namin, abot namin makakaya ni Dr. Mu regarding your cancer problem or cancer questions or whatever regarding cancer po. Okay?
Yun. What time, Doc? 2 to 5. Uy, samantalahin na natin, ha? Minsan lang nandito si Dr. Mu at syempre they're together ni Doc Alan. So, guys, 2 p.m. later at the Club Filipino. If you have any problems with cancer, if you have questions, please go there. Is it for free?
Yes.
Okay, so it's free. So please go there and check them out. You can also check their website and their Facebook page. No, you have a Facebook page as well. Okay, thank you, Doc. Doc Mufeng, of course, Doc Michael Hernandez. Thank you to our followers on our social media pages, Jing Castaneda Facebook page, Salamat Doc Facebook page, and our followers on our ABS-CBN YouTube channel. Thank you, and please share the information. Continue to follow us. Continue to share. Continue to like our pages. Thank you, Mami Jing Castaneda. Bye.